We're so excited to hear that you've booked your surgery with us here at Watt Plastic Surgery.
We're going to go through a few important details as far as your specific surgery and things that you need to know ahead of time so that you're able to have the best recovery possible.
We've created detailed videos for each procedure. So you've just finished having a facelift. We want to make sure that you have an amazing recovery, so we're going to go through a few of the instructions to ensure that you understand exactly how to take care of your incisions.
When you go home after surgery, you're going to have a head wrap on that's going to kind of make you look like a mummy. It's going to be very uncomfortable just because it's tight. And that's totally the plan. The good thing is when you come back the day after surgery, we'll take out the drain that's there, which we'll show you how to take care of the drain in a separate video. But I'll also take off that head wrap and we put another one on after that. You're able to go home that day, continue to take it easy. And then on day 2 after surgery, you take that off. And that's the first time you shower. And then once you shower, we will have given you another elastic chin strap that you put on. And we'll show you how to do that when we give it to you. But it's still going to give you some compression, but it's not quite as aggressive as the full head ACE wrap. You'll continue to wear the elastic chin strap full time for about a week. And then we'll see you back at 1 week. And that's when we'll take out the sutures. Generally, incisions that are in front of your ear are going to have sutures that we need to take out. And for the most part, the sutures behind your ear are going to dissolve on their own. If you had what's called a platysmoplasty, which is just a small incision under your chin, those incisions, again, are something that we'll usually take the sutures out at that appointment right about a week. As far as long-term recovery, this is kind of the same as most other things. Once you hit a month, then you're able to start doing stuff like exercising, going for walks, kind of being a little bit more active. But for that first month, you really just need to take it easy to make sure that you don't have any complications either with the incision or with kind of the underlying stuff and either start bleeding or having an infection. You just really have to take it easy. After a month, we can start talking about different things to do for the scars. Sometimes it can be just a matter of doing a scar gel and scar massage. Other times we can have you do either lasers or microneedling to help optimize how your scars heal. So we've gone through all the things that you need to know for the specific surgery that you're having. Now, just a general list of things that you need to know, kind of regardless of what surgeries you're having or what surgeries you're thinking about having in the future.
Never use a heating pad after surgery. We do not want you applying any heat to the area.
That also goes for hair dryers and ice packs. Even though ice is not heat, it can still burn you and leave very not great looking scars.
No sexual activity for at least 4 weeks after any surgery.
No exercise. And I know exercise is, especially in South Tampa, everybody wants to do something. They want to exercise. They want to be out and about. You need to not. And exercise means no going for a walk, even around the block. No walking your dogs, regardless of how big or small they are. No weights on your lower body if you just had upper body surgery or vice versa. No yoga, Pilates, nothing. If it's something you have to think about whether or not we would say, yes, you can do it, you can't.
No swimming for at least 4 weeks after surgery and no baths. For optimal healing, it's important that you avoid smoking or vaping for at least 4 weeks after surgery. It's a really exciting time in the medical field with the age of GLP-1 medications. With that, we've got a couple restrictions and recommendations to ensure you have the best results possible with your surgery. With surgery, you're investing your time, money, and recovery to have an amazing result. But if you continue to lose weight after surgery, you may have excess skin that recurs that you'll want to remove. We want your results to last, so maintaining a stable weight within 10 to 15 pounds is crucial to ensure a lasting result.
If you're considering a tummy tuck or a breast reduction or breast lift, and you're considering losing more weight before you would want to have that surgery, you can have a consultation with one of the members of our team to talk about the GLP-1 medications and if those could possibly fit into your treatment process. The bottom line is just make sure that you lose whatever weight you want to lose before you have those surgeries. Try to get within 10 or 15 pounds of that goal weight before you have surgery. The other important thing is all of those medications kind of affect your nutrition and how much you're able to eat, which then means how much protein you're getting. That directly affects your wound healing. So even if you stop those medications, you need to make sure that you eat an adequate amount of protein for your body weight to be able to make sure that you have enough nutrition, that you're able to heal the incisions, and that you don't have poor wound healing or other complications in the immediate post-op period.
No matter where your surgery is done, from head to toe, no tanning or sun after surgery for 4 weeks. After 4 weeks, if you are going to go in the sun, it's important to put SPF 50 or above on any incisions, even if they're below the bikini. The sun rays can go through clothing and still cause darkening of your scars. After surgery, we want to ensure that you have the quickest healing possible and make sure that there's no medication interactions. A lot of supplements can cause inadvertent bruising, bleeding, or interact with the medications we prescribed you. The only medications or supplements that you can take have been advised to at your pre-op appointment. The only vitamins that we recommend or allow are a multivitamin for 4 weeks after surgery.
If you're having surgery, regardless of what surgery it is, you're going to have a coupon book that you go home with. One of the things in there that's important is discounted scar treatments. Those can be very important to make sure that you heal as best you can and that the scars look as good as they can. Your esthetician or nurse practitioner that you see will kind of know the best timing as far as when they want to start each one of those individual things.
Common treatments our estheticians provide for scar care are microneedling, laser therapy, and also pharmaceutical grade medical skincare to help for the best scars possible.